Hi guys, welcome back to my YouTube channel. My name is Onyinye and I'm a mom of quadruplets based in the city of Port Harcourt, Nigeria. In case you're seeing my face for the first time, please leave me a comment and I will sincerely do appreciate. So today I don't want to waste much of your time. I just want to dive right into the question. From my facial expression, you will know that I am not okay. Like I am not fine. I know how painful it is that people will like spend so much money going for their IVF, and then at the end of the day they will come back negative. Some will even test positive at the initial time and then later on it will turn out to be negative. For example, there is one woman that contacted me the other time. She did her IVF and she tested positive after 2 weeks. Then they told her to come back in another 2 weeks for her scan. That scan is to know how many that are implanted. Then when she went for that scan, they were not seeing any sac. They told her to go and do another pregnancy test. It came back negative. So when the woman was now telling me, she was crying and I didn't even know what to say. She didn't do it here, I did my own. But I believe IVF is the same thing. In every hospital is the same thing. Then the other lady, she did not test positive. The other one tested positive, and then after 2 weeks they told her to come back to check how many they are implanted. Obviously two implanted, but they told her to come back another time to check heartbeat. There was no heartbeat, you guys. A lot of things can be a hindrance to your IVF success. A lot of things. See, if you notice, you know that I'm not even positioning this camera well because I did not plan to do any video. I'm going out to film my gas, but I just decided to film this video, and I'm even doing it with my front camera. It's not the one I'll come and position and be doing all those. No, I am so like, a lot of things can be a hindrance to your IVF success. Number one thing I'll be mentioning is your endometrium. Your endometrium is your womb. Most times, some hospitals will not even like, they don't care if your womb is okay now to carry a child to be transferred, for an embryo to be transferred. They don't care, especially people that batch people, like you pack so many people at the same time and do their IVF. You don't care if their lining is okay. You don't like, you just do it. If someone's endometrial lining does not get as thick as it should, or maybe it is too thick, I don't think that IVF will work. It will not work. I know in the case of maybe the person tested positive and then along the line there was no heartbeat, or there is no sac. See, all those ones are like a different case. But the one that you know that this person's endometrium is not okay yet, but because you just want to do your IVF, you collected money, obviously you just did anyhow, like your endometrium. Some people have endometritis. I mean, what do they call them? People that have such cases, most of them go for surgery. Most of them do, like, you should advise the person to go for, like, to make sure everything is okay. Make sure everything is okay with the person's womb before transferring an embryo. The money these people are spending on IVF, some people, they're not even like, they don't have a problem with spending the money. It's about the emotions attached to it. Like, their hopes are already high. Most people have done this IVF like several times. That woman, I said they did not see any sac. That one that failed is her sixth IVF. You guys, I don't even want to imagine what that woman will be going through. Like, I don't even want to imagine what she will be going through. The second one I'll be mentioning is your eggs, your egg quality. A lot of people, when you tell them to use a donor egg, they will not accept. People that are using donor egg, they did not plan for it. Obviously, everyone wants to use their egg, but when you find yourself in a position whereby you are told to use a donor egg, and this is something, you know that, there is nothing that can be done about it. They have checked the level of your egg. They have checked your AMH. AMH is a test that you need to do to know the quality of your eggs, to know your egg reserve, what is remaining, how good or bad they are. that is AMH. You check it, they have checked and see that, oh, this person's egg cannot go anywhere. They will advise you to use donor egg. Most people say, no, manage my egg like that, use it like that for me, I will use it like that, I will use it. The doctor know they chop your egg. If your egg is okay to be used, they will definitely use it. There is no way your egg will be okay to be used and then they will tell you to use donor egg. It's not like the donor egg is 100% guaranteed, but at least they use the younger person's egg and good quality ones, you get, because it's not all the eggs you retrieve for someone that can fertilize with sperm. So they will make sure that they use the best. Like if they fertilize it with the sperm, they will use the first grade of it to transfer to you. Most people use donor embryo. Donor embryo is not your egg, it's not your husband's sperm. They still use it, and at the end of the day, the child is their own. Nobody will know unless you tell people. Do you get? So when the hospital say use donor egg, try and consider using it, because even if you try to use your own egg, see, there is one woman that said the hospital she went to do her IVF, they said they will use they said her egg quality is 1.04, that the hospital said they'll give her medication to boost her egg quality. 1.04 for a woman that is close to 40. Even a younger person that has 1.04 egg reserve, like AMH level, will be needing a donor egg. Talk more of some woman that have come of age, woman that is going to 40. See, I just told her, so don't bother. Do not bother. Go for donor egg, because that's thing they say they want to boost for you, to not boost anything, because this one is now nature. Because number one, they have come of age, and you know, the more a woman age, the more her eggs depreciate. It's not like men that can give pregnant a woman even in their 100 years. Do you get? So when they say use an egg donor, they are trying to like maximize your chances. You understand? They are trying to maximize your chances. The third one I'll be mentioning is sperm quality. Like the quality of your husband's sperm does a major role. Like it can make the embryo to fail. It can make the IVF to fail. The quality of your husband's sperm. Most people think that, oh, no matter how bad the sperm is, it can still fertilize and all those things. See, it can fertilize though. It might fertilize, like it will fertilize with your egg. But turn to embryo one and remain in that womb where they put you. They no go gree stick. They no go gree stick. So it's not just about the egg quality. The sperm quality matters a lot. The sperm quality matter. When they checked my husband's sperm, it was okay. Even though they placed him on medication, I still went extra mile to make sure that, oh, this quality, the sperm comes out like that the sperm is of good quality. I have to like source for other sperm boosters for him before our procedure. Do you get? So if you know that, oh, maybe you are undergoing an IVF treatment and you are not even sure of your husband whatsoever, try and get him a sperm boost. Let him be on a sperm boost. Let him be taking the sperm boost. You can get cheaper sperm boost for him. You know, these men, they go out, they drink alcohol, they drink, some even smoke. They do so many things that can, be a problem to the sperm. So for you to be on a safer side, for you to make sure that at least you try your best to make sure that your IVF works, place him on medication. Place him on sperm boost. Especially, place him on sperm boost to take. There are so many other factors that can make your IVF to fail. Like so many other factors that can make it to fail. But me, I used to believe that everything lies in the womb. Because most times they will tell you, oh, we'll transfer grade A embryo for you, we transfer the best grade, and then at the end of the day, it will still fail. Do you get? The embryos were of good quality, but now it's your womb that did not carry the children. It's your womb. Okay, most people even test positive, and then at the end of the day, they will miscarry. It's from your womb. So many other things that can still cause it. Medication, like you went and took medication that you were not supposed to take. You did not even seek your doctor's opinion before taking any medication. You just took it on your own. Maybe you were having headache or anything. You decided to take it. And stress as well. Stress as well can hinder it. See, I came out today very pained because the amount of negative results People have told me this, but it's not just from my hospital. It's not from the hospital where I did my own. Like, so many other people from different states have been contacting me, and they are like, oh, see what happened. I did this. My own failed. I did not see heartbeat. I did not see sac. I did not do this. See, at this point, I am so stressed. I am tired. I just wish there is a way I can, like, everyone will just go for IVF and then to just be positive immediately. No other people keep coming to me to ask me, this is my own, is it the first time I'm doing it, or did I do 3-4 times before it worked, and all those things. Another factor is age. Age is another determining factor if your IVF will work or not. Yeah, I know that most age people will be like, oh, they will use donor egg. Yeah, using donor egg will maximize your chances as well, but your body that will carry it, is still another problem. Do you get? So I believe that if you are able to, put most of these things that I said in practice, like look into them, I believe that it will maximize your chances. And then you have rest. Our body is so fragile. No matter how hard we try to, look as if we are strong, we are not. We are not at all. We are not. So I believe if you can do a few of these things that I mentioned, see, I'm not even concentrated. I just called the few ones that I know. I still have to calm down, make a detailed video, even if it means going to that hospital where I did my IVF to, seek opinion of the doctors or the nurses there. So you equally hear from them. Okay? So this will be the end of this video. I'm already running late. I want to go and fill my gas. Please do well to subscribe to my channel, leave me a comment, like, and I will see you all in my next video. Okay, I wish you all the best. All the people going for the IVF, I wish you all the best. I wish you a successful embryo transfer. I wish you a successful implantation, successful everything.